Good afternoon. We are breaking into programming to bring you a live press conference with New South Wales authorities who are providing an update on the COVID-19 cluster on Sydney's northern beaches. Let's listen in.
Testing yesterday in New South Wales. That is a record we did not expect, and I feel so proud and deeply grateful that people have responded, not just in the Northern Beaches community, but throughout Sydney and throughout all of New South Wales, and that's exactly what we want and what we need to see continue. Can I also take this opportunity to thank the health workers and other allied support teams, support crews who are allowing us to do that number of testing. The pathology units who are working through the night. There are hundreds and thousands of staff across the state working 24/7, sometimes in very difficult circumstances, and with the inclement weather, with the bad weather in the last few days, we've seen a lot of our workers in the rain testing people under difficult circumstances. And I just want to express firstly my gratitude to the public, but then also to those who are conducting the tests and those who are actually in the pathology units working around the clock, because that is helping us fight the virus. Overnight in New South Wales, pleasingly, we only had 8 cases of community transmission, 7 of them linked directly to the Avalon cluster. The 8th one being, it could actually be an overseas acquired case. It was a transport nurse, someone who worked in transporting patients in quarantine, a nurse, and Dr. Chant will provide any further information about that. So in fact, the 8th case could very much turn out to be an overseas acquired case, but Dr. Chant will provide us with a bit more detail around that. But of course, what remains our concern is that even though the case numbers are relatively low compared to what we've experienced in previous days, the number of venues that are impacted, it grows. Because when you have people with the virus who've attended venues outside of the Northern Beaches community, it always increases our concern to make sure there isn't a permanent seeding event created by any of those venues. So it's not only important to lock down everybody who has the virus, but also to make sure that we get that information regarding their close contacts and make sure they are also tested, isolated, waiting their test result, or else in quarantine, in self-isolation, should they be found to be positive. So my message to the community today is thank you so much for your efforts to date. New South Wales is really pulling together to get through this stage of the pandemic. I want to thank everybody for their patience, and I also want us to turn our mind and our attention to people who know they'll be in quarantine in self-isolation over Christmas, because if you've been diagnosed and you're positive or you're a close contact, depending on your circumstances, you may very well be in isolation over the Christmas period. And I just want to say that we are thinking of you and thanking you, because you being safe and protecting you and your loved ones is also helping all of us in the state of New South Wales. As I've said previously, we'll be looking to make a decision tomorrow based on what we understand and know during the day. We'll be making an announcement tomorrow on what the future of the situation on the Northern Beaches, Greater Sydney, will be. At this stage, there's no reason for us at all to consider any changes to what's happening in regional communities. Suffice to say, though, that it's apparent to us, as we said yesterday, if you left the Northern Beaches from the 10th of December and you are in a community anywhere in New South Wales, you should be in self-isolation. You should be treating the situation as though you were living on the Northern Beaches, and that's really important. I'll now ask Dr. Chant to give her update, and then we'll take questions.
Thank you, Premier. So as of 8 p.m. last night, we had 8 cases that are locally acquired. 7 cases are linked to the Avalon cluster, and 1 case remains under investigation. The case that is under investigation is a healthcare worker from Western Sydney who was involved in the transfer of patients from the international airport. This case has transported several patients, but we have identified that they also have transferred positive COVID cases. We are obviously doing urgent genome sequencing to confirm that that is the source of their infection, and those results will be available later today. A close workplace contact of this healthcare worker has come back positive since the 8 p.m. figures, and that will be included in the count for tomorrow. In terms of the situation, I'd just like to acknowledge and echo the Premier's words in relation to the testing record. We've seen 44,466 tests were reported to 8 p.m. last night, so thank you to everyone. What is most pleasing is that we're also seeing those increases across other local health districts, as well as a massive surge in the Northern Beaches community. It is important that we get those high rates of testing across all of Sydney and New South Wales in general. So anyone who's got symptoms, please come forward for a testing. But please continue to monitor the New South Wales Government website for those venues. I know at about midnight last night we uploaded another 50 odd venues, and so it is rapidly changing. We're taking a very low threshold for listing those venues, so please keep alert and share that information with your friends as well. So in terms of the venues, clearly we are seeing some venue transmission in other sites outside the Avalon RSL and the Avalon Bolo in the Northern Beaches. But we are concerned particularly about transmission events that are occurring outside the Northern Beaches because residents in those areas are not subject to the same lockdown provisions as in the Northern Beaches. So I just want to highlight the fact that I'm going to mention some settings that we want to alert the community to particularly focus on and a call out to the community to respond. It is important that no one assumes that these businesses have done anything wrong. These businesses are cooperating fully, but the reason I'm highlighting them is because we are most concerned that transmission events have either happened at them or because of the circumstances that transmission events could possibly have happened to them. And we're particularly focusing on venues outside the Northern Beaches. The first one I mentioned yesterday, again, was the Rose of the Australian Hotel Erskineville, and can I just acknowledge the great collaboration we've had with that hotel in terms of ensuring we've got the information we need. So just one patron dined there from 7 to 9 p.m. on the 15th of December whilst infectious, and another diner has tested positive on Sunday, and we believe there has been transmission from the first person to the new case at the venue, as they were both diners there at the same time. The second case was part of a work dinner, and all attendees at that dinner are being tested, but we're also investigating how the contact between the first and second person occurred, because that's quite casual contact between those. And again, thank you very much to the venue for working with us to investigate how that transmission event. But I would urge anyone who has been there, they should be self-isolating. They are close contacts. We have had transmission, and please get tested and self-isolate if you haven't already done that. And remember, if you are self-isolating and you get symptoms, even if you've had a negative symptoms at the beginning, if you get symptoms recurring, you need to get retested. Following the diagnosis of a COVID-19 in a staff member, all patrons who were seated at the Paddington Alimentary Deli and Cafe in Hopetown Street, Paddington, from December 17th to 19th are considered close contacts and should get tested for COVID immediately and isolate for 14 days from their visit. New South Wales Health will be calling patrons to confirm their isolation dates, but in the meantime, immediately isolate, get tested and remain in isolation. Takeaway patrons should monitor for symptoms until the January 2nd and isolate and get tested immediately should any symptoms develop. If we have any indication of further transmission, we will potentially strengthen our advice in relation to that deli and cafe. The Blacktown Gym, so New South Wales Health can advise a confirmed case visited the Body Fit Gym at Blacktown on 27 Sackville Street on Wednesday the 16th of December from 7 a.m. to 8 a.m, Thursday the 17th of December from 7 a.m. to 8 a.m, and Friday the 18th of December from 7 a.m. to 8 a.m. So anyone who attended any of the following venues at the time specified is considered a close contact and must get tested immediately and isolate for the 14 days regardless of the result. We haven't got transmission at that event, but we know that gyms are high risk for transmission, so we want to take a very precautionary approach and get people to be aware of their need to isolate immediately. There's also been the state sewage surveillance program has detected traces of the virus at a treatment plant in Hornsby Heights on Saturday, December 19th from the sewage system that drains parts of Barawa, Cowan, Barawa Heights, Hornsby Heights, Mount Colah and Mount Karingai, Asquith and a small part of Hornsby. New South Wales Health is aware of 2 COVID-19 positive cases in the area who are linked to the Avalon cluster, but as a precaution we want to draw people's attention to that positive result. It may be linked to those cases in the area, but regardless we urge people in those areas to be vigilant for symptoms and please attend for testing. Also, we had notified to us last night a case in a returning Victorian resident. It's pleasing to see that case was self-isolating, and I can confirm that the family has been self-isolating in Sydney and have tested negative to date, but are following all the rules that are required in terms of isolation. Thank you.
Can you just clarify something around these 7 new cases linked to the Avalon cluster? So 2 are Northern Beaches residents, 5 are not Northern Beaches residents, is that correct? And of those 5, were they contracted and transmission events outside of the Avalon RSL and Cola?
So I would have to get the breakdown of the details of the cases, but my recollection is that they're all really linked to the events, to the sites in the Northern Beaches where we've identified cases of concern. So there's nothing suspicious there. I'll have to check, but there's 2 questions: whether they were isolated at the time. I believe that's increasingly occurring. Whether they were isolated for the full infectious period, which is the 48 hours, I will also get you that information.
That Sydney case that's popped up in Victoria. Their health minister has said they stopped at a regional town in New South Wales.
Yes, that's correct. So, yes, certainly. So the family stopped at Oliver's Real Food Outlet at Gundagai mid to late afternoon on Wednesday the 18th of December. So advice will be going out to the community in Gundagai who may have also accessed that real food outlet.
Where had that...
Sorry, Kerry Clark, the case, you mentioned nurse transporting people from the airport. Did that nurse have any interaction with the return traveller coming on December 1 and positive?
No. The person transferred, the healthcare worker who was involved in the transport, which is the 8th case that we're under investigation. We are aware that they transported a symptomatic family of 3 from the airport on the 14th of December. And genomic sequencing will come back later today. Can I let you know that we will release the results on the genome sequencing as soon as we have it? It's clearly a relevant point to our investigation. Obviously, I tell you every time that we take an open mind. Obviously, given that history, we would believe that the person acquired it through their work in transporting the patient, but we always keep an open mind, and but no links to the Avalon cluster were determined for that person. They came from the US.
Dr. Kerry, so this could potentially be the 3rd incident in the past few weeks where we have had something creeping out from a hotel quarantine. We had the housekeeper at the hotel potentially had this lady who's come back from the United States, and now this 8th case today. Is this virus getting more contagious, and is our line of defence in New South Wales strong enough from stopping it treatment?
So that we don't have any evidence that there's fundamental changes in the viruses that we've been encountering that would indicate any difference in transmissibility of the virus. What I think is important to know is that clearly if you're transporting 3 infectious patients, we need to review. This notification came in yesterday. We have worked very quickly to look at all of the aspects of that might have been associated with that transfer, but the person did transport 3 infectious patients. We will just look at whether there are any breaches, and sometimes those are inadvertent. So sometimes a patient will take off a mask, sometimes a patient doesn't tolerate wearing a mask at a particular point in time. So there are always a number of elements here. I don't want to speculate until we have the genome sequencing and we've done a thorough investigation.
Do you think that we should stop flights from the UK, given this super strain that is coming out? Do you think we should stop receiving New South Wales?
So the Australian Health Protection Committee considered the information about the UK strain. Obviously we need to, I suppose the advice is to take a precautionary approach, but there is a lot of science to still work through. There may be very many other reasons that explain the observed increase in transmissibility of that virus, or the growth rate of that virus. So what we need to do is just redouble our efforts to make sure everyone is aware of the infection control requirements.
There are now 6 cases, Dr. 6 cases linked directly with hotel quarantine for transporting returned travellers or air crew. 2 security guards, months back, the hotel cleaner, the van driver, this transport healthcare worker, and a close contact with this transport healthcare worker. Clearly, there's some leakage in the system. What do we need to do to ensure it doesn't happen? Also considering the virus may have leaked from this number 1.
So we understand that this virus can be highly transmissible and people can be highly infectious. There's often variabilities in individuals in terms of their stage of infectiveness. It is important that we make sure the end-to-end process of people that are returned overseas protects the broader community spread. But can I just say, it is actually a credit that we pick up some of these transmission events. So part of the issue is that occasional transmission events will occur, but the fact that the person came forward for testing means that the system's right in that we can prevent any further transmission to the community. So I don't think any system can ever guarantee that we won't have any transmission events. Other similar situations such as New Zealand have had a number of incursion events as well. It is also about how you surveil, pick them up and respond to them that is important. I think it's inevitable that these issues will arise. We try as best we can to minimise them, but it is about the response and the actions of individuals.
Dr. Chan, do you have any idea just how many people are in isolation? I mean, the Premier mentioned it a short time ago. You said that there's over 50 new health alerts overnight. How many close contacts are currently locked away in isolation for the next 14 days? Any idea?
There would be very many thousands and thousands of people that are currently in isolation. And can I echo the Premier's comments? I really appreciate the efforts of people that are adhering to the isolation guidelines, and the feedback I've had is people are doing the right thing. So it is important. We need to remind people that there is a reason we isolate you for 14 days, and that's because the virus, even though you've had a negative test today, you can be positive tomorrow, you can develop symptoms tomorrow. So it's incredibly important that you remain in that isolation.
Can you cope with policing them? Can you cope with keeping an eye on them, or you're just really at a trust level now?
Look, we have escalation procedures to police. Look, the New South Wales community has generally been incredibly positive and compliant. You know, there have been cases where we've had to involve police, but that's not the usual way. The vast majority of people do the right thing. They don't want to be the reason that there is transmission spread into the community. They want to protect their loved ones. And I think that we've seen the changes in behaviour over the last week, and the response to testing actually really makes me feel proud to be a New South Wales resident at this time.
Sorry, an alert has been issued for the testing clinic at the Avalon Recreation Centre. We've been told by people that some people are queuing for 2 hours.
So can I just...
How many people will potentially be exposed, and will the protocols around testing?
So look, can I just confirm that we are trying to get the venue lists out very quickly. That needed probably more assessment before we put it up there. The person who was positive, who got a positive test result through that clinic, was wearing a mask. I'm advised that they've got good infection control, but for the abundance of caution, whenever we have a positive test result, we do a forensic investigation about whether there could have been any lapses or breaches to make sure that we've provided that advice more broadly. So that will be changing, that advice. But for the speed, it went up and someone didn't recognise that it was actually a testing location.
Dr. Chan, we're aware of a specific example, and it's only the one, where the information given to somebody who went undergone a test is that they have been cleared or subsequently been sent another message from New South Wales Health saying, no, you need to isolate till the 26th, and another message the following morning saying, no, that was actually wrong in theory. What sort of mistakes and slippage are we seeing in the IT side of things?
Look, I think rather than speculate at this time, I am aware it would be appropriate for us to, if you give me the details of that, I'd be very happy to do that. If there have been any lapses, we were the first to admit those lapses. I am aware that we are following up one issue about test results and thing which didn't impact on the person isolating, but we're just responding to one case. But it's not been raised with me. I take those matters seriously. Please provide us the details and we'll look into it.
So you suspect it is not widespread, that it's just the odd anomaly?
Look, I suspect it is the not widespread, but you know, we need to get the feedback. If there have been mistakes made or errors, the staff are doing the best they can. They are really working very hard, but we need to have a reminder and look into any issues that have been raised.
The Northern Beaches Facebook pages have been in overdrive trying to solve the mystery to William Food Page 0 centres. Are they proving to be helpful at all?
Look, I have really. I think it's great that there's so much enthusiasm in terms of understanding epidemiology. It's been a passion of mine, and I'm great the Northern Beaches community. And the Premier is actually a great detective. She often gets to the answer before many others. So thank you. But I think the point is that I think I've said it before. You know, now is not it's really counterproductive to the public health response if we're spending our time blaming or tracking down areas or asserting that people did stuff. At the moment, the key focus is on people isolating, adhering to the stay-at-home orders, getting tested if you've got symptoms, and following our isolation guidelines if you've been identified as a close contact.
Dr. Chan, sorry, just one more, Dr. Chan. Would you be able to just give us some idea of how many contact tracers are working on this outbreak? Staffing, how many calls are making, and are there any staffing issues because of the Christmas break, people being brought back to work?
Look, we're now continuing to scale up our contact tracers. As you can imagine, with us taking a very low threshold of venues, it does generate a lot. Our process is that when we get those venue lists, and I think we've talked to you a lot about why we love the digital records, that we then, what we call, we use the term protocon, but in essence it's a text message. So what people will get, if you have gone in, used your QR code, and the venue can provide that to us, we will then protocol and give you immediate public health advice, and that can happen within whenever we've recognised a site, so very promptly, and that will tell you you've been in a venue where there's been a COVID case, please immediately isolate and get a COVID test.
Can you compliment you've got enough staff for contact tracing?
We are scaling at the moment, and I'm confident that the resourcing will be adequate. People need to bear with us but they also need to watch out for those protocols. And can I just say that I understand it's sometimes tricky when you're entering that data into those apps if you're not concentrating and you miss a digit. Please just check again, because we have a portion of our protocols don't go through because there's probably some minor digit issue. And again, I can understand that when people are out, they're not thinking about that, but if people could just be particularly attentive. And I would like to say that, again, as per yesterday, if people could understand how they could access their private providers, our contact tracing staff have real-time access to the Service New South Wales data, which again reduces any loops. So once we have a venue identified that is using the Service New South Wales app, we can immediately access that data and send those messages immediately. but we know that some venues have got private providers, but please find out how you contact them, particularly over the Christmas New Year period, a time when there may have a little bit of additional trouble.
Dr. Chan, on this yesterday, before your press conference, was asking Northern Beach staff to report the work, saying they're essential services. You gave your comments, other inquiries were made. What's now reversed that decision? Right decision?
Exactly. And look, when we mean essential workers, we really mean people to reflect very hard on what that means. We want the Northern Beaches community to be as locked down as possible. And we really thank the community for taking this action. It is really to protect the broader residents of New South Wales. And I just want to say thank you.
Premier?
May I ask you about the case in Ulladulla? Obviously, somebody from the Northern Beaches went down to Ulladulla and the closure of the swimming pool. On a wider level, what's being done to sort of protect regional New South Wales? And also, would you consider, if not putting Sydney into a lockdown, Greater Sydney into a lockdown, perhaps travel bans, a travel zone?
Look, at the moment, the trend is going where we want it to go, where we need it to go. Yes, it's volatile, but we're confident that the strategy we've put in place is having the desired effect. So the policy settings at the moment are doing what we need them to do, so long as everybody comes together and complies. And the vast majority of people have been just amazing. And Dr. Chant and I, when we saw the number of tests come through and the way in which people are complying, it really does give us a boost to know that the measures we have in place, plus the way the community is responding, are really supporting us in getting on top of this latest outbreak. In relation to some members of the community not doing the right thing, it's a very small minority. And again, in response to that specific question, remember our health advice also was that if you'd left the Northern Beaches after the 10th of December, you should be treating yourself as though you were living on the Northern Beaches. So if you left on the 10th or 11th of December and you went to a regional community, or you went to another part of Sydney where you're staying with a friend or a relative, you have to assume that you are living in your home on the Northern Beaches and make sure you are not leaving the home unless it's for those essential reasons. So we believe the policy settings we have in place at this stage are the right ones, and as I've said, on the basis of the advice provided by Dr. Chant and her team, we'll be making a decision tomorrow as to what happens after midnight tomorrow night, and that will be based on the most recent information, plus also looking at the trends that have been occurring, plus also in particular looking at the multiplicity of venues and what that means outside of the Northern Beaches. And whilst the vast majority of cases are all linked to those two events on the Northern Beaches, we know now that there's more venues out there, and what risk does that pose? These are the types of questions that the health experts will provide us advice on, so that government, in consultation with Dr. Chant, can make that announcement tomorrow.
So if it's working, there may no reason to change if it's working.
Look, there is, obviously the decision would be much easier if it wasn't this time of year. If it wasn't this time of year, the decision would be much easier. But obviously we do need to consider mental health issues. We need to consider what people are going through as part of that decision as well. But we also need to consider what it means for our 8 million citizens across the state. And that's why we will be taking the best advice available at that time. And that's why we always say that during a pandemic, things evolve by the hour, things evolve by the day, and we will base our decision on that best information we have.
Is there potential that you could have a gathering of 10 in the Northern Beaches? To keep it all on the same...
Yeah, look, I don't want to rule anything in or out at this stage, but all I will confirm, and Dr. Chant will correct me if she's uncomfortable with me making this statement, but I think to date, the policy settings we've had in place, coupled with the community's response, has demonstrated our strategies are working, and we'll base our decisions on what's occurred in the last few days. But I'm not prepared to rule anything in or out because it's evolving, and we'll have to take the best information tomorrow before we make that decision. I'm sorry.
New South Wales set itself apart from the way maybe Victoria has managed things, or Queensland has managed things. You realise that there is also a human impact with this, and you're trying to move with an evolving situation. That tug of war between science versus people's mentality.
Look, there is no doubt that when we consider decisions we take, and Dr. Chant has even part of her mission as a Chief Medical Officer, it's not just to look at the health impacts, but societal impacts, what it means for the greater population. You have to assess the medical risk against the risk of other things which will harm the community. And so we take all of that into consideration in New South Wales. That's why we waited until Victoria had consistently 140, 120, 180 cases a day before we closed our border to Victoria. I mean, that was a big step we took. You know, there's also an element of holding your nerve. If you have confidence in your processes, you have confidence in the strategy, you do also take that into account. So I hope people appreciate in New South Wales, we try and look at the big picture, we try and be compassionate as well as assessing their health risk, and also the impacts on people's livelihoods and the mental health issues. So we do try and take that collective approach. And we also make sure that the decisions we take consider the 8 million people in the state and not just particular groupings in one place or another, because we appreciate that at times, depending on the nature of the pandemic, some members of the community do take a heavier responsibility than others. And in this instance, it's the community of the Avalon area and the Northern Beaches that are really bearing the load of having to contain the virus, and we appreciate that deeply. But we also appreciate that the decisions we take look at the bigger picture, and that's why my frustration at various stages of the pandemic with my other colleagues in other states is please consider the compassionate grounds, and there are parts of New South Wales completely unaffected by this current outbreak, and yet everybody in New South Wales is suffering because other state leaders have made decisions.
Today's numbers bode well though, don't they, for potential easing of restrictions at the CLC tomorrow? And I guess in particular, one example is the aged care, currently locked down. Set to come, that ban is set to come off tomorrow night. But is that something that would change, or is that too big?
Look, there's no doubt that the trends are where we'd like them to be. The response from the community has been just outstanding in terms of the high testing rates. But the threat of the virus spreading is there because of the number of venues that have been impacted, even mildly. And as Dr. Chant said, we take a very precautionary approach in New South Wales. We put information up there as soon as possible, and we always take the cautionary approach. So sometimes a venue may subsequently be ruled out, but it's important for us to get that information out to the community as soon as possible. And can I please stress this point? When I observe some of the practices that other states have done, when I observe the timeliness in New South Wales, I take my hat off to Dr. Chant and her team of contact tracers to be able to get this amount of detail to you on cases that were only confirmed by 8 p.m. last night is a real credit to our health team. A real credit to them. And I really want to stress that, because I challenge any other state to have this much information publicly available at that short period of time. And these are part of the weapons in our armoury that we're really able to deploy to control the virus to the extent we have. But we also appreciate and experience that volatility is there, and you might have low case numbers one day and they might creep back up. But I'd much rather be hovering where we are now than where we were 2 or 3 days ago. So it does give me a degree of comfort that now we're hovering around, you know, single-digit numbers as opposed to mid-teens or 20s or 30s. But certainly it's volatile, and we have to look at the situation as it develops. I'm sorry, I'll come to that in a second. Yeah.
Is there any capacity, given the restrictions, to get rapid tests, perhaps the antigen tests, the rapid antigen tests to people in isolation currently? So that they can get there to get clear.
Yeah. I'll ask Dr. Chant to quickly answer that question, and then I'll come back to the mic because I know there are other questions. But also please know that for key workers that's available, but I'll ask Dr. Chant to comment on it.
Okay. Can I just say clearly, please do not rely on a test result. If you are a close contact, a test result today does not mean what you are this afternoon or what you are the next day. So if you have been told to isolate for the 14 days, please do so.
Premier, just on masks, you say you're happy with the way the community has responded. Public transport, sitting at checks. Well, there's been an increase, but people aren't really listening. 70% still not wearing it. At what point are you looking at that?
Well, look, clearly if the case numbers were going in the opposite direction, you'd look at all the settings. But given where we are now, we believe very strongly, and I've used this word a lot in the last few days, to having a proportionate response to what we're experiencing. But can I also stress what Dr. Chant has just said? The reason why people are in quarantine for 14 days or isolated for 14 days is because you might be negative on day 2, but on day 10 you might be positive. And in fact, I believe the integrity of the New South Wales system has been such because we've identified a lot of people on day 10 because we've kept them in there for the full 14 days. And early on in the pandemic, some states weren't doing that. So I just want to stress what Dr. Chant just said. It is so critical that if you've been asked as a close contact to stay home for 14 days, even though you've had a negative test, you might be positive on day 13 or day 12. So please take that advice. It is so critical. And the statement Dr. Chant just said now, we cannot repeat enough. If you've been asked to stay home for 14 days, no matter what your test result is, you have to stay home those 14 days. And that's why at the beginning of this press conference, we expressed our empathy and sympathy to people who are in self-isolation for that period, especially as they know they will be in that period, they will be in isolation over Christmas and potentially New Year's, depending on when they were identified as a close contact. I'm sorry, that was the next one, yeah.
You take your personal ideologies on that, and would you consider allowing a conscious vote on allocation?
Look, can I say it's not government policy, and I would prefer that issue wasn't debated, given everything else we're facing. And my personal view, it's a very difficult issue, and I know that people have very strong views either way, and I know that I'll get a lot of correspondence for expressing my personal view, is I'm uncomfortable with such a policy. That's just my personal view, but I know many in the community have a very different view, and I think we should be respectful of that. But can I stress, it's not government policy to debate it. I would prefer it did not come forward at all, but that's not always up to me, but I would say that is my strong preference, and it's not government policy to debate it. It's at this time, and it's not government policy to have it come forward.
You've relied on the goodwill of.
I'm sorry?
You've relied on the goodwill of the community, but there are people who are in the queue waiting to be tested in a drive-through at Bondi, and they've been charged by the police for using their phones as they sit in the queue and fined $349 and hit with 5 demerit points. Will you look at that? I mean, that sounds a bit...
Yeah, can I say that I understand, and I might have, the numbers I might have may not have been the most updated, that 9 people were in that category, 7 of which have now been reverted to a caution. So 7 of those fines have been revoked, but I understand for 2 of those fines there were additional issues. So
common sense prevailed.
Common sense prevailed, and we always ask for discretion at this time. But can I also say this is why New South Wales is cautious before you mandate anything, because it then raises a whole level of different issues. And to date, the overwhelming response from the community has just been fantastic. And we want everybody to keep it up. And we appreciate that for some people it's a bigger burden than others. And we know this Christmas and New Year's for all of us will be looking different. Can I say none of us will have the same Christmas and New Year's that we've had. And I remember spending Easter Sunday by myself for the first time ever and what that felt like. But I know that for many people around the state, they'll be thinking about the next few weeks and days. But I know top of mind for all of us is for keeping our loved ones safe.
Last question, please.
I know that Christmas Day is important for so many people, but it is just another day. Is it worth rushing through a lockdown to potentially see this cluster exponentially grow again?
Well, these are all the things we're considering, and that's why we need to be cautious in our approach. And I noticed in New South Wales, not only are we cautious with our approach, but I think we assess the risk well and then make decisions according to that. Unlike some of my other state colleagues who have taken what I think are overreaching actions given what's happened in New South Wales, and that's a matter for them. What we try and do always in New South Wales is take a cautious but balanced approach and make sure that we consider everything in a holistic way.
Thank you, everybody.
Can I just ask you about the advice? The advice for people wearing masks, or all the people to wear masks anytime they're outside or their own home when they're indoors, that advice also extends to people in the Greater Sydney region. Now, yesterday, Brad has and Chris made a point of wearing masks for the media conference, removing it when they were speaking, and putting it back on when they weren't going to get them mask today. You didn't wear a mask yesterday, why not?
Oh, they've both been in the Northern Beaches area, which I haven't. So, and can I make this point? The health advice, and Dr. Chant is here, is the health advice is strongly that when you are in indoor settings, when you are in high-risk areas outside of the Northern Beaches, you should be wearing a mask. I wore my mask yesterday when I was shopping. and I expect everybody else to as well. If you're catching public transport, if you're going shopping, if you're at a place of worship, if you're at any indoor event, you should be wearing a mask at the moment in Greater Sydney, and I have been, but you also need to make sure you follow the health advice.
Premier, one last question, sorry. It's always one last question.
Yeah.
Do you feel it fair, maybe, would you consider approaching the federal government, it's well known that New South Wales' share of GST revenue is often shared amongst other states, but given the burden New South Wales has shouldered throughout the entire year of COVID, do you think it's fair maybe to apply to the federal government to ask that that GST share be redistributed and more money brought into New South Wales?
Look, at the moment, with all due respect, there are greater priorities we have to worry about. But I do say this. Overnight in New South Wales, we had 10 people in hotel quarantine that tested positive. We know the infectious rates are going up overseas. We don't stand here and tell you how many were Queenslanders or Victorians. We don't do that in New South Wales. I do feel New South Wales has done more than its fair share, and I ask other states to do the same. And I look forward to other states stepping up. Thanks, everybody.
Would you consider seeking more GST revenue?
That's a debate for another day. Thank you.